So this is the global evaluation of cholecystectomy, which Tan and Leaf, as you probably know, is the word for taking out the gallbladder. And so that's what they're studying in this international study. This was sent to us probably about 2 weeks ago. And here are the main organizations, and these are the international hepatobiliary societies. So those are the main surgical societies for people involved in gallbladder and liver surgery typically. And what it involves is, so they have these different periods of data collection, and before which you need to have like IRB approval and things like that. So you have these 8 different periods, it's 8 different periods of data collection that are just about a week or so in length, maybe 2 weeks in length, looks like 2 weeks. And what happens is that essentially we collect data from our institution of patients who have had this particular operation, and then create, and then there's a way to upload it. And the goal is to have, and it's uploaded into a REDCap database, and then they do the analysis. And the way they do this project is that they gather all the data, analyze it, and then everybody who's participated can be a co-author on the paper, which if you're talking about like 100 different institutions across a number of different countries is a lot of people, but it's still a useful thing. And here are the sort of goals. So it's to look at the variation in practice, and then, what are the key steps in a gallbladder operation? Is that being followed across settings? What are the adverse events? What are the rates of gallbladder cancer? And what sort of practices are available? And then to address assess sustainable practices as well. So it's interesting as an opportunity for us to be involved in a couple of different ways. One, we're involved in creating laparoscopic training courses. So from that standpoint, it sort of makes sense for us to be involved in studying what good looks like, and how that compares across the world. And then it's also just a matter of saying, like, this is sort of the most comprehensive assessment that there has been. So why not take part of it? And there are some other things like, you have to have these things in existence. You have to be able to do these sort of surgical steps. And so it's an interesting study to consider. And then we have to look at and see what kind of complications patients have. So they want to have mini teams of up to 5 collaborators. And so we would need to assemble that as a team, and then go through the process of getting the IRB approval and all that kind of stuff, which with de-identified data should be pretty fast. And the fact that we have all this material already means that we can copy and paste a lot of it into an IRB application. So that's this project. And it sort of goes over the next year essentially. And I didn't look at the timeline closely enough, or didn't show it to you closely enough to see how long it takes. But the last of the data capture is actually November. So it's really next 6 months. So that's that project. We're trying to decide, is this something that would be worthwhile for us to invest our time and energy to do, to contribute to and participate in. So thoughts from anybody interested in helping with this kind of a project, and with eight blocks of data collection, having multiple people, could be to do. Yeah. Thanks, Anna. Yes. I don't know if we can include it in the IRB we already have. But yeah, I think that's certainly a great point. Tan?
Yeah, thanks for thinking about us in terms of this. Really appreciate it. Would this be gallbladder surgery in terms of scheduled surgeries or unscheduled, like emergent?
Yeah, unscheduled and emergent. Yeah. And it's basically, you wouldn't collect that information in that emergency time frame. Like you would collect, like, I have to finish reading the rest of the protocol, but the way I envision it is basically you would look at what's been done in the previous 24 hours to kind of capture who all had that operation and then gather their information and enter it. So over the course of 2 weeks, could we have, my guess is at our institution, we probably do maybe a couple a day, like 2 or 3 a day, for over the course of 2 weeks. So it's not an enormously onerous thing, but certainly, like, if you waited 2 weeks and then tried to do it, it would be a challenge. So, which is why it makes sense to have like a team of 5 people, so that each person has like 1 day of data collection, kind of a thing, or something along those lines, or a couple of days, and kind of based on schedule, so that everybody can contribute and participate. So yeah, so that's kind of how I envision that it would be. But I'm happy to send this protocol out to you guys, and you guys can all review it and let me know. You certainly don't need to like volunteer for it right this minute. The goal for this session today was to kind of share this as an opportunity that is available, and that I think it's reasonable for us to participate in.
Yeah, so I'd be open up to it. So
yeah. Yeah, so I think that's an opportunity. There's another opportunity that I don't know if you all would quite be able to help with, which is actually writing a book chapter, which again, it's something that's happening in the next 6 months. And probably one of our residents and one of our fellows would be more likely to help with that, because that's going to be a much bigger thing, and we're waiting to see how many authors we can have, and we might have authors from around the world, so it might take a little bit more sort of coordinating, I'd love to have you all maybe read it, or see different versions of it, because it's about global surgery for one of our main surgical textbooks, so you can at least you can help review it, or edit it and kind of review it from the standpoint of, if you are reading this chapter from for the first time, what are the things that are missing? What are the things that would be useful to clarify? So as sort of relative novices in global surgery, but still folks who have been interested in this field, we might have a lot of different opinions of what to include and what not to include. So anyway, so that might be another opportunity, but probably less intensive for your purposes. So yeah, so those are just other opportunities that are coming up. At Tan, I was talking to Dr. DeReese about the innovation paper, and I think she's kind of busy this summer, so I'm not sure she has the time for it. So I got the impression that she wanted to just hold on that for a while. So, but we can see what else works out for you to work on.
Sounds good. Thank you so much.
Yeah. Yeah. So you want to go around the room and see who else is working on what, and what updates everybody has? Leif, you're next on my screen. Aside from MCAT studying.
Right. So yeah, I'd say update from the Mongolian side, nothing's really too new there for liver transplantation. I think we're kind of phasing out of that with Dr. Rodriguez moving just over to the University of Utah. That right now that's kind of on hold. So that's there. And then breast cancer, everything's still moving along. We meet once a week. I know that one of the surgeons is trying to come here to Utah They've been arranging with Minnesota at least to come for the next 6 months there, and they're trying to do 1 year and do an alternating 6 months here and 6 months there. So that's the only kind of newish thing, is there might be somebody coming relatively soon. And then
Yeah.
Camp,
Yeah, Dr. Brownson was talking about creating a mini fellowship, but I thought it was 6 months total. I didn't realize it was 6 months.
I'm not exactly sure. I haven't heard about it recently. It's either 6 months here and 6 months there, or 3 months here, 3 months there.
Yeah,
6
yeah.
months was the timeline I was given.
yeah. So there are two different things that are sort of being worked on. One is a sort of a mini fellowship for the Mongolians to learn about breast cancer surgery and breast cancer treatment. So including med-onc and radiation oncology. And come and visit both the University of Minnesota and us. And then there's also a separate attempt for creating something like that for the folks in Ghana. So having a couple of Ghanaian surgeons who are also interested. So we're trying to see if we can marry these different projects so that they're here at sort of, they're not
Right.
here all at the same time, but they're getting sort of consistent content. So there's been some discussion about how to streamline the curriculum and how do we, what do we cover and what they need to learn. And, a lot of it also depends on what is available in their health system. And so there's some attempts at trying to figure that out. But yeah, I think those are all in progress, in various levels of progress from the sounds of things. So
Right. Yeah, well, I guess we'll just hear what ends up coming from that.
Yeah.
Because I mean, I don't know how he's going to do so well in Minnesota, because he does not speak a ton of English, at least the Mongolian surgeon. So that will be interesting, just to say the least. And then Cambodia is probably the next big one. Looking at possible upcoming trip in the fall outside of September. I think Dr. Price is looking in October now, and just moving the program to a new section within Cambodia. So what I've been doing as of lately is working with some doctors from Kampong Cham, and we're actually collecting all of their laparoscopic data right now, similar to what you're talking about with Gecko. Mainly cholecystectomies is their main operation that they do there. In fact, I think that's the only thing, just as a basic level of laparoscopy. So just collecting all that data and then hoping to be able to, Dr. Price is presenting that to, I believe, that the church organization here this week, because they want an update on the actual data itself. And so possibly going back to Cambodia there. And we had our paper, our poster that was accepted at the American College of Surgeons in Boston this fall. That's related to Cambodia. So that was pretty exciting. And we'll still see what's going on there, because now that Angel's in residency, I'm really not sure who's going to be presenting that data.
yeah,
So
he may
we'll see.
be able to. He may be able to, because the ACS is in Boston, so just
Right, so it's close.
So he especially if he has something accepted, usually residencies are pretty good at
Letting him go. Cool. And yeah, that's probably the simple gist. The projects are moving along. Cambodia's going great, and maybe with Mongolian, some are coming soon. So
okay, great. And Dr. Rodriguez and I talked a little while ago, and the issue is that they're in the process of they've lost a couple of transplant surgeons the last few months here, for various reasons. They've moved on to other jobs, and so they're in the process of hiring new folks. And so when they're short-staffed, it's not the time to be able to do other non-clinical things. So everybody, it's all hands on deck, taking call, taking care of patients, taking care of the things that need to be taken care of. So everything else is on pause until probably for at least another 6 months, until things have reached a new equilibrium, and then you can go back to kind of doing things. So that's what he's sort of talked to me about. We'll have to see. Do you know, Leaf, if he has submitted all the reports for this year?
So no, I think that he's not going to submit, because with submitting them, it's renewing the grant. And from what I've understood is that he's not going to, yeah, because I'd probably be the person to do that. And
Well,
he hasn't reached out to me about anything.
Yeah. Well, I mean, typically, yes, you have to kind of, when you submit a report, like at the end of the year, also asking for the next year's funding. But you're obligated to send in something at the end of the year, just because typically that's how
Right.
mechanisms work for funding, is that you have to say like what you do with the money. So yeah, anyway, if you can just ping him when you get a chance and confirm that, and because that's something that we can finish up for him, that will help him, then that's something we should be able to do.
Yeah, I can reach out for sure.
I think that'd be great. Okay, cool. All right. Who wants to talk about what they're working on next? No, if I muted myself. Sylvia, I know you don't have any specific projects yet and you're looking for a project. Do you want to just quick say hello to the group and introduce yourself?
Sure. Hi, everyone. Thanks for letting me join. I'm Sylvia. I'm a fourth-year medical student at the University of Utah. Wild. I helped with the Global Surgery Student Alliance with SUDA in my first year and a half of med school or so. As a fourth year, I'll have a little bit more time, more towards the fall and like next spring, to help with some projects. And I'm happy to help with the Gecko study with a few things. I have some research experience. It's not like my first thing that I'm great at, I'll say, but I'm, very open to learning and really excited to work with everyone.
Cool. Sylvia and I were going back and forth about opportunities in Latin America. And we actually have one of our trauma fellows is in Colombia at the moment. And she and I were texting yesterday about this relationship we're trying to set up with a university in Cali, Colombia, as well as one of the private hospitals there. So she'll be presenting, I'm hoping, in the next few weeks when she comes back at this Works in Progress, and that will be an opportunity to kind of see how and where we can be involved with that collaboration. It's meant largely as a sort of a clinical exposure and clinical partnership for our folks, and then for them to gain research and innovation exposure. So that's sort of what each group wants out of the out of the relationship. But that being said, we can certainly see what opportunities come out of that. So just something to keep in mind and look out for in the next few weeks. I don't think she'll be. I think she'll be presenting in July, most likely. So it won't be before then. So, okay, great. Heidi, do you want to comment on any of what you're working on? I don't know if everybody knows Heidi. And Heidi, some of the students know you, but do you want to introduce yourself?
Hi, all. I'm a pediatric nurse practitioner in pediatric urology, and right now I've been working primarily with Ray on his laparoscopic courses work and stuff in Cambodia and as well as Ethiopia. And a couple of things to add, in addition to what Leif shared, is we're going to be working on some content this summer. It's going to be a big push because we're wanting to look at some more advanced material to teach laparoscopically in the fall. And we also have a couple colorectal surgeons that are hoping to have a day of content to work through, or a day and a half of to work through. So we're hoping to get that all uploaded to Thinkific by the end of the summer. And so they had a meeting last week that I missed when I was out of the country. So I'm waiting. I need to connect with Ray to get an update as to what they've decided as specific content and subjects that they want to cover. And then so that's that piece. And then I will be also be working with Catherine. Dr. DeVries, she's been involved with putting together a task force for global surgery within our specific specialty of pediatric urology. So I'll be kind of working on both sides of that piece. So.
And you didn't mention the DNP.
Oh yeah, so And so my life's about to get a little more crazy. When I went to school eons ago, there's no such thing as a doctoral prepared nurse practitioner. And so I'm master's prepared. So I am I'm starting a MSN to DNP program in the fall, focused on organizational leadership. And hopefully I hope to do my DNP scholarly project through Global Surgery. So
Very exciting. Congrats, Heidi.
thanks.
Yeah, and I hope you and Katie Ward can connect. She's, as I mentioned, she's one of the nursing school faculty. Our medical school and our nursing school are in the process of renewing and formalizing relationships with the University of Rwanda. And one of the requests from the nursing school in Rwanda is to help develop advanced practice nursing. I don't know if it's the cadre itself or at least training programs to create the cadre. So that is an explicit request that our nursing leaders are trying to think about what to do and how to do it, and how do you bring that, what does that look like? And the challenge is that even the various pathways to get nursing licensure in Rwanda are not as robust as they are in a lot of parts of the world. And a lot of the nurses in the country are not bachelor's trained. They're associate degree or even sort of high school level. So they're kind of more like they're somewhere in between like a CNA and a LPN or along those lines. So there's a lot of need to upskill the nursing profession in the country. And so there's a lot of interest in how to do that, and how we at the University of Utah can contribute to that. So hopefully that'll be a I mean, that's a big project, right? But hopefully that's something that would be great for us to contribute to. And from the standpoint of surgical nursing, right? Because like, what is more intimidating or most intimidating, right? In any, like in medicine or nursing, like it's
Right.
surgery.
Being
So,
your.
Yeah. So
So yes, no, thank you for that introduction. And I emailed her, and she emailed me back yesterday. And so we're going to meet together once fall semester starts.
Yeah.
So.
yeah, I think I think that'd be great to do that. So
Thank you for the intro.
yeah, we'll see how that goes. Other folks who's working on anything else that they want to discuss, Hafsa or Anna, got any specific projects? Am I missing anybody else? Otherwise I can say that McKenna, who's one of our undergrads who's just graduated, just submitted and has accepted a paper from my project in Rwanda, which is very exciting. And then we have an EMS nurse from Rwanda who's just submitted her first author paper from our project, and we're hoping that'll be accepted very soon. So that is also really exciting. And then there are a couple of other papers that are in various degrees of trying to be written and or finished. One on trauma QI, one on implementation of checklists in Rwanda, and then another on trauma registry analysis. So 3 different papers, and all in various stages of being finished. And I just cannot seem to get folks involved to get any of those finished anytime soon. So we'll see. So that's where that is. Other things from anybody else, and any specific projects that you want to talk about? Oh, sorry, Anna. Okay. All right.
I mean, I can talk about some of the projects we've got ongoing, but I don't know if it'd be of interest to anybody really. We've got our Intro to Academic Global Surgery program that we're working on, which I don't know how much everyone knows about it, but we have something right now on Canvas. It's kind of very basic. It's more so a list of resources and different readings that someone could look at to start getting a feel for global surgery, especially in the context of academia. What we're looking to do is really expand this into 2 courses. One they're both introductory courses, but one's more basic for perhaps undergraduate students who might not have any idea at all what global surgery is. And then another one that, even though it may be introductory, it's a bit more advanced for maybe those who are medical students or trainees or even attendings that work in medicine, but not necessarily in the global health space or specifically global surgery. So far, we have outlined both courses. We've decided on modalities for both courses and have written up objectives, very specific objectives for what we want them to learn about each specific topic. The team will be meeting, I think, early next month. I have to check the calendar to discuss next steps and then really look at the content for each modality. But it's ongoing. It's Tan's main project as our global surgery scholar. We will be doing a short presentation on it during our, I forget what we're calling it, our innovation showcase. So if you're going to be attending that, you'll be hearing a little bit more about it then. Another thing we've continue to work on that we've established is our MSTI program. So if anyone's interested in that, whether it's now or later, reach out, can give you all of the information about that. But we have a track within that degree program that's specifically about global health innovation and technology. We are continuously working on it, improving, trying to see what is necessary to those doing the work right now globally. Very exciting. We got some funding to fund a couple of people from an NGO that will be starting the course this fall. And we're working on actually co-listing some of our courses that we offer specifically for that track through the School of Medicine. So our medical students can also take advantage of those courses, even if they don't actually participate in the MSCI track, they can at least still participate in the courses, get to learn a little bit more about that as well. Students touched on this here and there. We're also working on establishing a standard process for international rotations. Right now, it's mostly for our fellows within the Center for Global Surgery or within the General Surgery Division. But eventually we might be, we're trying to get it established so that anyone throughout the department or even in other training programs in the GME world at the university can participate in that as well. And then the final thing is just we've been really working on formalizing the different training pathways we have available for scholars in the Center for Global Surgery. So there will be very specific tracks for if you want to focus solely on research, if you want to focus solely on clinical work, if you really want to focus on education, those sorts of things, as well as making it easier for visiting scholars, such as doctors, practicing doctors or trainees from other countries or institutions, to make it easier for them to collaborate with us, not necessarily just shadow or observe. And then the last thing is just not only advanced laparoscopic training in low or middle income countries, but also advanced educator courses for the doctors that practice and live in those countries so that they then can go on to teach and train others as they come in, as they become qualified, etc. So then they can sustain the program themselves instead of us going back and having to do multiple trips. I think that's it. Hopefully that was succinct enough.
Thank you, Anna. That was great. Comments, questions, thoughts from others? Any of those things? Okay, cool. Hafsa, do you want to add anything?
No, I'm just working on the same like few things I talked about on Monday. And Dr. Nunes actually emailed me yesterday about this Gecko project too. And I went through it briefly, and it looks like everything is in there. So I asked him, let me know where he needs my help, and I'm happy to help. So he said he will schedule a meeting, and then I got his email this morning about the other study, which was the Lancet Global surgery stuff for Utah.
Okay.
Indicator one. So I think the application, it seems like the application is about to drop out or something. So he's like, I need to do it now.
Okay.
So he asked me to schedule, like he said, he will schedule something for next week for that.
Okay.
So I will be helping him with that. And other than that, I'm just working on a project with Dr. Device for her red cap thing.
I think Hafsa, if you have time, if you can start the IRB application for Gecko, I think that would be really helpful.
Okay, I can do that.
I just emailed that protocol to
Yeah. Okay.
many of the folks in this group who expressed interest. If you didn't get it, let me know. It means I forgot to
I
put
do
it.
have- So it will be exempt or not
It would be what?
exempt study or? are
I
we-
think so. I have to read through that protocol further.
Okay,
But I assume so, because we're collecting any patient level, patient
right.
information.
Mm-hmm.
It
We are
should-
not. Yeah,
Yeah.
okay,
Yeah,
Okay.
so I think it should make sense. So it should be pretty easy, hopefully.
okay. All right.
And our IRB is super fast and awesome, really
Okay.
advanced IRB. So compared to other places, so that'll help.
Okay.
So great. Okay, well, I think if no one else has anything else, I think we're finished kind of catching up on different projects that are going on. Next week, we don't have a meeting, and the following week we'll have the showcase. So if you're available, feel free. There's going to be food 3 to 5 on the 28th. So look out for more information on that. Anything else? Anybody else wants to have any questions, comments, thoughts? Okay. All right, cool. Okay, well, have a great rest of the day. Good to
Thank
see
you.
Bye, everyone.
Yeah, bye.
Everybody.
Bye.